We are joined today by Mr. Arevalo, Ms. Arrizon, and Mr. Shelton. We will begin with Mr. Arevalo for opening statements.
Hi, my name is Alberto Arevalo. I was born and raised here in Hollister. I was actually born in Gilroy, but raised in Hollister. I left Hollister for a few years. Went to college and came back, and now I'm here. Want to serve my community.
Yes, hi, my name is Elizabeth Arrizon. I was born and raised also in Hollister. I left to go attend CSU Stanislaus in 2003, and I came back and I now own a Hollister taxi, and I am here trying to serve my community and better our healthcare.
Well, thank you, BenitoLink, for giving us this opportunity to discuss our situations and our histories. Anyhow, I've been a citizen of San Diego County for 47 years. I've been a Zone 5 resident for 20 years. And, we started our own business about 40 years ago. It's a Main Street business. We run an insurance brokerage, primarily providing employee benefits, as well as individual plans to thousands of people in Central California. We've watched the population of Hollister explode. And anyhow, we also saw the hospital address the specific needs of its citizenry as over the years. After 113 years, Hazel Hawkins is still going. Thank you.
Rural hospitals all over the nation are struggling. What ideas do you have to make Hazel Hawkins a successful and innovative hospital?
So my ideas, like I said, I have a business that's called Hollister Taxi. We do transportation. And I have ran into occasions where I hear clients' concerns, and I want to bring that to our hospital board and see how we could better our hospitals in, giving resources to our patients, being able to actually know where to get the correct help, or having training for our staff. One thing that I believe we could look into is maybe looking into fundraising, looking into places where they could bring money in. We need to project money in order to get maybe better doctors in our system. Like I said, something where we could give programs to these patients and just itself bring the client's information back to the board and see how we could better it overall.
The Hazel Hawkins, with its designation now of critical access, is in a different financial position than what it's been in the past. To address the needs of the local people, that we need to really focus on recruitment and involvement of primary care providers, as well as bringing more specialists to town. We have a number of our providers who are about ready to hit their golden years and be retiring, and we really need to replace them on a very rapid basis, as far as I'm concerned. As far as the needs of the community, we need to really, we need to address the homeless issue, we need to address the underserved population, and we need a coordinated effort with all the providers of San Diego County to address these needs appropriately.
I feel we need to make it more appealing. Like, as I've been walking around and meeting with the citizens in our zone, the same theme comes up over and over again, that as myself, I take care of my elderly mom and dad, and will constantly have to go out of town to help them. I have to take time off, to take them over there, to provide the help. So we need to provide these services to all our elderlies, instead of them having to leave town, they can stay around town. And we need to provide our nurses and doctors with up-to-date technology to help out with all these things. So those are the issues I've been coming to account by knocking on doors, and people are actually concerned that they have to get a lot of their services out of town. So we have to make this hospital more appealing, and then just so people could be more happier to come in and serve it all. Thank you.
Hazel Hawkins recently gained critical access designation, which meant reduction in the number of beds. How does this impact the community for better or worse in the light of the COVID-19 pandemic?
The reduction in beds was, it's basically it's a 50 or 52 bed facility. They had to reduce the number of beds down to 25 to get to that critical access designation. What the positive is, well, the bed count, the actual vacancies or the actual people in beds on a daily basis have been running between 11 and 16 beds have been occupied for a number of years at this point. So the critical access I don't believe it's going to hurt the hospital. In fact, financially, it's going to aid the hospital because they're going to be able to charge Medicare for seniors and the ones who are disabled prior to 65. They'll be able to charge a rate that reimburses the hospital for its actual expenses. Prior to this point, Medicare was not reimbursing them enough to cover the expenses. Some hospitals estimate it's about 50% of what the actual charges are. The COVID situation has also been adding more people into the beds. Thank you.
Well, I don't know if it's worse or better, but I remember, if I was informed right, when this town was 25,000 people, we had 4 ICU beds. This population has grown twice as much, and we still only have 4. So it could be worse, just in case what if a second wave happens and this hospital gets overwhelmed. I think at the end of the day, we just have to wait and see. But we should increase the amount of beds, just for the amount of growing population that's coming in and the influx that's continuing to come in. We'd be able to serve the community because we don't want all the beds to be full. So we should be good.
So I did hear about that, and I was shocked at first. But once again, I go to the fact that if it's going to better our hospitals and the revenue, where now we're getting paid through Medicare a little bit more and getting more money that way, I think it's good. But I do think that we need to make it a little bit more inviting when the people get to the ER, and we let them know that we're there to serve them. But yet, if there's not a bed available, we could refer them to another hospital. But we do want to have them come into our facilities so we can, get that revenue, get that money in, check them in, make them feel comfortable, and then if we don't have a bed available, we could always refer them out. But once again, I go back to the fact that we do have to make our ER and our staff more inviting. As soon as they come in, we need to let them know that we're there to take care of them and that we want to make them feel safe. And if we don't have a bed, there's always a resource where we could refer them, or we could call somebody out and have them be taken care of somewhere else.
What kind of experience makes a valuable and competent board member, particularly when you take into account the hospital's sizable budget?
If I'm representing the people in my zone, we should be able to be communicating with as many people as we can to see what their concerns are, and then bringing those concerns over to the board and hopefully work with the community so we could improve the situation, so our community could have confidence in Hazel Hawkins and not travel out of town to get good care. And there's good care here in town, but people still seem to be leaving out of the area. We want to keep those patients in the area to bring in the revenue, and it's just, there's this stigma, and people are just also worried that not all of their insurance companies are covered in Hazel Hawkins. So we just got to bring back the confidence to the people of Hollister to continue staying home and continue staying in Hollister to get their health care. Thank you.
With that, I'm actually great at trying to do some funding and bring in revenues and stuff like that. What I think, again, we need to make the Hollister community get that confidence again of coming into our hospitals. As of right now, we know that a lot of community members think, you know, you go to Hazel Hawkins and you're going to die. We need to change that in order for them to come to our hospitals and bring that money, bring that, you know, so the revenue stays with the community and it actually works out here. And we generate money where we're able to bring in, you know, more help, more doctors, more specialists, more technology. Just like I said, we just got to work in the budget so we could raise revenue, have people come in, and the money just starts flowing in. Thank you.
The first thing I'd be looking for is to make the hospital a place where people want to go, echoing some of the previous sentiments here, instead of a place where they have to go. You know, when we see people traveling out of town for their medical services, that's a losing battle for everybody, especially our community. The board member should be answers directly to the CEO. And the CEO is actually the steering point for the board's activities. So with the recent hiring of Steve Hanna, the new CEO, I think he's an excellent choice. I was part of a committee that got involved in the choice, bringing it down to just a couple. Then the board made their final decision. The hospital itself has, you know, every day is a new day, and the staff. All it takes is one person to sour the grapes, so to speak, and to keep people from not coming in there. It's important that the staff understands that and that they appreciate what they've got, and not appreciate what they have, but go to work every day and make it a positive experience for the patients in there if it's at all possible.
Oh, thank you. Thank you for the opportunity to actually hear me out. Like I said, I just want to put an input of what I hear patients going through and bringing it to the board and bringing these concerns. I want to work with everybody and with clients and with the board and make it a better hospital. I too have 2 parents that are older and they need that, and I want to see a better warming welcome and have people actually go there and just make it a better facility. Oh, thank you.
Again, thank you, BenitoLink, for this opportunity for all of us. You know, the last 47 years has allowed me to watch a lot of things happening, including the fact that I was able to watch my 3 sons grow in this county. To my total pleasure is the fact that I've got 4 grandchildren in this county, and hopefully more coming, that will be able to enjoy some of the fruits of what we're doing here. Anyhow, Hollister is our home. I want to make a big difference, and the point is, I would love to be on the board to help make that difference. Thank you.
Yeah, I would love this opportunity, and thank you again for this opportunity. But I got a degree in Spanish education, and for the people serving in Zone 5, there's a lot of people who aren't well informed with the services that this hospital provides. I want to run to make sure that they're able to go with confidence, to go in there to be able to get those services. And once again, I thank you for this opportunity and being here.
So I'd like to thank you all for attending the BenitoLink 2020 Election Forum Series. This concludes our session.